Myself, Dr. Chandan Mahesh, consultant implantologist and root canal specialist, practicing at Implant Dental Care at HSR Layout Sector 2, 19th Main. Removal of the tooth involves inducing local anesthesia, wherein the dentist will give a block or an infiltration to that area and he tries to remove the tooth. At the time of removal, the patient will be absolutely fine. But post removal, the challenges are how he needs to take care. We tell the patients to just bite on a cotton which has been given as a pack on the particular area, and the patient is asked to bite that particular cotton for at least half an hour. In the time span of 2 to 3 minutes, there will be a formation of the clot, wherein the thrombin and the prothrombin factors inside the blood will help in the clot, and the clot, once it is formed, the bleeding would stop. As soon as the bleeding is been stopped, we tell the patient not to take anything like gargling the mouth or anything hot or anything spicy, not to be taking that. The only reason is the clot which is formed, if it is disturbed, the patient would end up with rebleeding, or the bleeding will induce again, wherein the stopping of that would be much more challenging. So we tell the patient to just keep an ice pack over that and to have an ice cream, so that the gelatin in the ice cream will give him a feeling of that taste of the blood which just goes out, as well as the ice pack over that particular extraction area. When he rubs with the ice, the cold thing will just give him a satisfied feeling, as well as he doesn't like to try to gargle or disturb the clot which is formed there. We tell the patient again to visit the dentist post 1 week's time, so that to see whether the healing is all happening in a very neat and clean way. Failing, which would lead to multiple infection called as dry socket, wherein the patient will see severe pain, or else if the particular infection happens through any smoking or drinking post extraction, again the particular clot gets disturbed and the patient would be in severe pain, which if he visits the dentist, we'll have to take this in a different way to treat it, wherein multiple antibiotics as well as painkillers should has to be induced inside the patient. So post operative care is just simple, just putting a cotton pressure for half an hour and removing it after half an hour, not disturbing the clot for at least 7 to 8 hours of time, and continuing his day-to-day habits the next day would all be fine. In a case wherein a suture has been given, it would be much more easier, wherein the particular food habits can be restored back within a day or two, wherein he can eat whatever he loves to eat and there will be no much food restrictions if a suture is placed. Thank you.